Alright, we're looking at the great saphenous vein in the medial thigh just above the Hunterian perforator, and as you notice on the duplex ultrasound that as we go down we start getting pulsation in the great saphenous vein. This is more or less the area of the Hunterian perforator. If we go either side of it, parasagittal, we don't see that there's an arteriole next to it. If we go in transverse, we notice that there doesn't seem to be an arteriole running parallel to the great saphenous vein. But further down, you'll notice the great saphenous vein remains pulsatile. If we go further down the leg, you'll notice the pulsation actually increases. We are now approximately in Dodd's perforator area. We are now just below the knee, great saphenous vein, medial calf. You'll notice very obvious pulsation in the great saphenous vein. We go distally. Now, if we do follow the area of maximum pulsation and we examine for a collateral flow or an adjacent blood vessel feeding into it, we do in fact see that there is another connection to a posterior accessory vein which is pulsatile. It's difficult to say exactly where the arteriole is introducing its flow, but this is definitely coming from posterior. If you look at the position on the leg, you'll see that we've moved to the posteromedial aspect. We go back to the screen again, you'll see exactly where we are there. And then coming anteriorly again, you can see there's definitely a connection feeding into the great saphenous vein. That is a connection between those two truncal varicosities, so the pulsation may very well be coming from a posterior arteriole. Right, we're looking back on the right leg, this time with the patient prone, and you can clearly see the great saphenous vein below the Hunterian perforator. It starts to become pulsatile. At this point, we're actually tracing this vessel posteriorly. You'll notice that there is a bifurcation, the one going to the medial aspect of the calf and the other one going posteriorly to the calf. This is also pulsatile, running very superficially and connecting via an intersaphenous branch back to the great saphenous just below the knee. So there's an entire circular flow of blood from a posterior accessory to the great saphenous around the knee. Further down, you'll notice that there's very clear pulsation. We do see a pulsatile arteriole in that area. It doesn't seem to be responsible for the problem.